Tuberculosis remains one of the world's deadliest killer diseases. The World Health Organization says Nigeria ranks 6th among the high TB burden countries. Today on Sound Health, this is our focus. I am Olasumbo Modupe. Thanks for always joining us. The conversation begins after this break. Please stay tuned.
Friends, colleagues, and partners. As we come together to commemorate World Tuberculosis Day, we stand in solidarity with the millions of people who fall ill with TB each year, and we pay tribute to the millions who have lost their lives from this preventable and curable disease. We would like to salute all the health workers at the forefront of the fight to end TB and other diseases, including communities, civil society, and advocates, national TB programs, partners, and donors for their tireless dedication and support to the fight to end TB. TB remains one of the world's deadliest infectious killers. Each day, close to 4,400 people lose their lives to TB, and close to 30,000 people fall ill with this preventable and curable disease. While global efforts to combat TB have saved an estimated 74 million lives since the year 2000, the COVID-19 pandemic, coupled with the conflict, other crises, and socioeconomic inequities, has reversed years of progress made in the fight to end TB.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Victor Adepoju, Project Director, HIV and Infectious Diseases, JPIGO, Nigeria, and affiliate of Johns Hopkins University. Good evening and thanks for joining us, Dr. Adepoju.
Good evening and thanks for having me.
All right, Dr. Adepoju, how deadly is tuberculosis? The World Health Organization says it remains one of the world's deadliest infectious killer diseases.
Tuberculosis, of course, is a deadly disease, kills up to 1.5 million people annually. But of course, it's also not a death sentence if you diagnose it very early. And more difficult is the fact that the mortality from tuberculosis also increased during the COVID-19 pandemic, giving the world a major setback to some of the gains that we have made in the past. So yes, it kills, but early diagnosis can help us to prevent some of the mortality from tuberculosis.
All right. Is the setback you mentioned as a result of why Nigeria is ranking 6th among the ITB burden countries?
Yeah, so I would say Nigeria has always been on the map of very high burden countries all over the world. But I must also say that the situation in Nigeria has been that of progress, especially over the last 3 years with support the National TB Program as well as Lagos State TB Program. You see, most of the terrible indicators that Nigeria used to report have actually changed over the last 2 to 3 years, especially with COVID pandemic. Nigeria government was quite innovative. We explored most of our community systems during COVID. But to answer your question, in most countries where we have majority of most of this setback, a lot of couple of issues. Number one, because of the lockdown, people could not access TB diagnosis and treatment. Also because of the pandemic, most of the resources for tuberculosis were also diverted to COVID. For instance, priority was given to COVID-19 testing instead of TB. I know most of the machine used for both of them are kind of similar. So also the workforce for tuberculosis, many of them were also diverted to respond to COVID-19 patients. So these are some of the challenges that came with the COVID-19 pandemic. But I must say that Nigeria was able to adapt well, and it's been a story of progress for Nigeria TB program.
All right, Dr. Adepoju, thanks for that explanation. Before we look at what causes tuberculosis, can you tell the difference between a normal cough and TB?
Yeah, so for a normal cough, I think one hallmark of TB cough is the fact that usually a chronic cough. We define that by a cough that has lasted for 2 weeks or more. Whereas any other disease, maybe pneumonia or upper respiratory tract infection or cough, you notice that it might not last up to 2 weeks. So that's the first difference. It's chronic and usually 2 weeks or more. The other thing is that most of the time, cough of TB, and that's why people do, we don't want to call it antibiotics without proper diagnosis. Some of them, most times for TB, you notice that it might really relieve the patient. After taking antibiotics, it might relieve the patient, but it doesn't mean that it has gone. And may come back later with more difficult type of tuberculosis, known as resistant tuberculosis. And that's why it's advised that a clinician see a patient and properly evaluate when somebody is coughing, because not all cough is pneumonia and all that. It could be TB cough. And it would be dangerous to start treating that with antibiotics. So those are some of the different. Of course, clinically, we can differentiate TB cough from that of things like asthma. Asthma cough is usually, different from TB, the pattern of cough in TB and all that. And also, you might have TB cough also present with other things like weight loss, or even in some situation, fever and all that. So these are some of the things that, a high index position is really needed to really determine if it's cough from tuberculosis.
Okay, apart from the duration now that you mentioned for about 2 weeks and the pain and all that, what other symptoms should a person watch out for before diagnosis? Do you need to wait for about 3 or 4 weeks before you say you're seeking medical help?
No. I think the advice is that we should take every cough serious. We should take every cough very serious. And there are usually 4 major cardinal symptoms of tuberculosis as entrenched in the National Tuberculosis Guideline. One of these is cough that has lasted 2 weeks or more, fever, as well as things like weight loss. So these are some of the cardinal symptoms: fever, cough of 2 weeks or more, weight loss, and even sometimes night sweat. But we also know that at the complicated stage, patient can also have cough that is stained with blood, what we call hemoptysis. But we don't want our patient to get to that level, and that is why it's very important to really seek health care and support from healthcare workers very early, as people, we know most of our patients still visit the private pharmacy shop as the first point of care. They might be exposed to antibiotics and some other, and they can even be managed for other things, maybe like malaria and all that. But not give the time to diagnosis and the time to really start or initiate treatment. So that's why it's very, very important that we seek healthcare services where anybody is coughing from a healthcare worker and the healthcare facilities to be able to delay the time, to be able to fast track the time to diagnosis and commencement of treatment if found to be tuberculosis eventually.
Okay, in this part of the world, self-medication is not strange, it's everywhere. We see people go to the pharmacy to pick 1 or 2 cough syrups and all that. Is it because treatment is not accessible?
Yeah, so I think one of the things that the government of Nigeria is doing, and that is very commendable, is the fact that they've also gone deep down to the community level. 60% of health-seeking behavior in Nigeria is being attended to by the informal provider, patent medicine vendors, community pharmacies, private clinics, who are, funny enough, they are closer to the patients and they are embedded as part of the community structures. And the type of services they provide tends to be more private, more confidential, and then most of our people, they prefer to visit these private informal providers. And what government has done is also to train these people, train patent medicine vendors, train community pharmacy, who are the professionals, on how to really screen for tuberculosis, diagnose patients, and if found to be TB presumptive, refer them to where they can get diagnosis as well as start treatment. So I think the cascade of tuberculosis care in Nigeria is very clear when it comes to the first point of call, who are the patient medicine vendor and community pharmacists. Government has trained a very large number of them to be able to recognize these symptoms and refer patients to appropriate services, diagnosis and treatment services, without wasting time and delaying diagnosis, which might also lead to negative and bad outcomes for the patient.
All right. The World Health Organization says this disease is deadly, but people still don't regard it as deadly. Is it because we don't have more information out there? Or why is it that we still disregard tuberculosis, despite the fact that you said it is treatable, but people wait till the end before they access treatment?
Yeah, I think we just continue to promote community awareness, which the government is doing very much in it. Lagos State government and government of Nigeria is actually doing a lot on that. They are doing that through mobile testing approaches. Some of the trucks called community trucks, mobile testing trucks that goes to the communities to sensitize people. The government is also using a radio channel, television channel, social media to promote awareness about tuberculosis symptoms and how people can recognize it. But again, maybe we need to do more, especially in rural communities who might not be living, may not have access to some of this information and all that. Probably we need to do more. But I think it's real, tuberculosis is real, and people need to be aware of it. And one of the other challenges of tuberculosis is that the latent phase can stay up to 10 years. So the organism can stay in individuals what we call the latent phase for up to 10 to 15 years. And the person might not know that he has it. And it is when that person has something that can diminish the immune system. For instance, the person now acquires HIV, or the person has cancer, or he has any chronic organ failure in the body, that tuberculosis can now flare up. That tuberculosis that has been existing quietly for the last 10 years will now be flared up when the patient has additional immunocompromised symptoms. So these are some of the barriers to health-seeking behavior for tuberculosis, but we'll continue to do more because TB can give rise to a lot of complications if not attended to, including infertility even in women. There's a recent study that talks about in India that talks about more and more women who go for IVF having tuberculosis of the womb. So we need to take it seriously because it can spread to every part of the body and cause more deadly symptoms for people.
All right, Dr. Adepoju, 1.6 million persons died of tuberculosis in 2021. Do you feel the plans to eradicate TB by 2030 is under threat? Because in less than 7 years, the deadline is just there around the corner.
Yeah, like I said, that data was a very historic and saddening setback for tuberculosis community around the world. You know, before 2021, we were able to reduce mortality to around average of 1.4 million a year, between 1.4 and 1.5. But you see, in 2021, just after COVID pandemic, we have about 200,000 additional mortality from tuberculosis. And like I mentioned earlier, it's not because the community is not doing enough, the stakeholders are not doing enough, but because of our lack of preparedness for COVID-19 pandemic. And like I said, some of the challenges on how COVID-19 pandemic has really resulted in a major setback for tuberculosis. But I think it's a learning curve for us, for global stakeholders, tuberculosis community, patients and government, to really learn from COVID-19 pandemic and put systems in place so that when we have this kind of pandemic in the future, it will not lead to major setback on some of the chronic diseases that we have made a major problem, for instance, tuberculosis. So our health system needs to be prepared better to be able to respond to this kind of pandemic and minimizing the ripple effect on other disease program in the future.
All right, your call to action as we wrap up this segment, Dr. Adepoju.
Yeah, I think my call to action would be that governments we need to invest more in diagnosis. Good enough, Nigeria now has a lot of point-of-care diagnostic machines for tuberculosis. These are technologies that probably will use battery to operate those devices, and they are not being deployed to the rural setting. For instance, we now have a lot of TrueMax machine in the country, as opposed to GeneSpar machine that are presently in the facility that requires generator, that requires solar, something to power them. This technology will just require battery, and they can now be used in the rural area, hard to reach area, and that will going to help the country a lot to really diagnose TB on time. We also have now shorter regimen in the country that patients don't need to spend 24 months to take treatment of drug-resistant TB. In 6 months, patients can now, complete their treatment for GRTB. And I think government just need to invest more and more into some of these innovative diagnostic and treatment tools that can help us to quickly achieve our goal of eradicating TB by 2035.
All right, can you emphasize again so that members of the public can know that tuberculosis is treatable and how to avoid this deadly disease?
Yeah, so tuberculosis is treatable, is preventable, and is curable. That's the good news about tuberculosis. I've mentioned the emerging cardinal symptoms of cough, usually cough that has been there for 2 weeks or more and is not residing. I think the patient needs to go to the facility and see a doctor to be able to evaluate that person further. The treatment, the diagnosis is also free, and the result can be available the same day. So there is nothing to worry about. When you go to the hospital, the doctor sees you, tracks you, asks for your history, they take you to the hospital and they send you to the lab, and within 24 hours, that result can come out. So our people need to seek health care facility and stop self-medication so that early diagnosis can give them early diagnosis and starting treatment on time and reducing the mortality and morbidity from tuberculosis. So we need to create more awareness in schools, in every place that we find ourselves, the community, town hall meetings, traditional ruler, religious leader. We need to talk about these first symptoms of cough, fever, weight loss, and night sweat, and educate our people on this, and make them to know that treatment is free, and within 6 months they can complete their treatment. Diagnosis is also free of charge, provided by government. Thank you.
Not all coughs are ordinary. You could have tuberculosis. Seek medical help early enough. Treatment is free. Dr. Victor Adepoju, Project Director, HIV and Infectious Diseases, JPIGO Nigeria, and affiliate of Johns Hopkins University. Thank you so much for your expertise on the program. We really appreciate you.
Thank you very much for having me.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Cough over 2 weeks could be tuberculosis. Seek medical help early enough. Dr. Adepoju says treatment is free and accessible. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.